Malaria is a potentially deadly disease caused by parasites Plasmodium species, and they are transmitted to people through the bites of the female Anopheles mosquitoes. There are 5 species of this parasite which cause malaria in humans: the Plasmodium falciparum, ovale, malariae, vivax, and knowlesi. 2 of these species, Plasmodium falciparum and Plasmodium vivax, pose the greatest threat to humans. The World Malaria Day is an occasion to highlight the need for continued investment and sustained political commitment and action for malaria prevention and control. The theme of this year's commemoration, Time to Deliver Zero Malaria, Invent, Innovate, and Implement, with the slogan, Act Now. Nearly half of the world's population was at risk of malaria in the year 2020. And despite the fact that malaria is a preventable and treated disease, Africa carries the heaviest burden of this disease, with over 90% of malaria infections and deaths occurring in this region. In the year 2021, there was an estimated 234 million cases and about 600,000 deaths, with children under the age of 5 accounting for about 80% of these deaths. Nigeria accounts for about 31.9% of the global malaria deaths, and this is approximately 200,000 deaths in the year 2021. Over 60 million Nigerians are infected yearly with malaria. Economically, about $1.1 billion is lost yearly due to malaria-related absenteeism and productivity losses in Nigeria. A recent breakthrough in the fight against malaria is the development of the approved malaria vaccines. The first approved vaccine for malaria is called the mosquitoes, and this vaccine has been administered to about 1 million children living in areas with moderate to high malaria transmission as at April 2022. It requires at least 3 doses in infants by the age of 2, and a 4th dose extends the protection for another 1 to 2 years. The vaccine reduces hospital admission from severe malaria by about 30%. The most effective of the malaria vaccines is the Matrix M, with a 77% efficacy. It's more effective than the mosquitoes and has been approved by the Nigerian government for vaccination. There's, however, ongoing research for a more effective vaccine. Malaria is an acute febrile illness with symptoms appearing 10 to 15 days after the bite of an infected mosquito. In some cases, it can take up to a year before the onset of symptoms. Initial symptoms could present with shivering, accompanied with chills and rigors, and this could rapidly progress to fever, with temperatures reaching 40 degrees centigrade, headaches, and vomiting. Left untreated, symptoms could worsen, leading to severe anemia, difficulty breathing, and coma. Multi-organ failure could also occur in severe cases. Some population groups are at considerable higher risk of contracting malaria and developing severe disease than others. These include infants, especially children under the age of 5 years, pregnant women, patients with HIV/AIDS, sickle cell anemia patients, and migrants or travelers from a non-malarious region. Efforts to reduce the burden of malaria continues to face multiple obstacles, particularly in the African region, which carries the heaviest burden of this disease. Disruptions during the COVID-19 pandemic, together with other humanitarian crises, health system challenges, restricted funding, rising biological threats, and a decline in the effectiveness of core disease-cutting tools are all undermining progress towards global malaria goals. Disability and deaths from malaria have been shown to drastically reduce with the following interventions. Number 1, the use of insecticide-treated nets. These are the primary vector control tools used in most malaria endemic countries, and they simply form a protective barrier around people sleeping under them. And the nets are known to also kill mosquitoes. Number 2, the rapid diagnostic tests, or RODTs. These enable healthcare providers to quickly diagnose malaria within minutes and initiate appropriate treatment. Malaria diagnosis can be made within minutes, and test kits can be used without power supply. RODT are used in many facilities in Nigeria. Number 3, artemisinin-based combination therapies, or the ACTs. And this combine artemisinin with another drug, making it more effective in the treatment for Plasmodium falciparum malaria. Number 4, the use of intermittent preventive treatment for malaria in pregnancy. Because pregnant women are predisposed to having malaria, the WHO recommends 3 or more doses of sulfadoxine pyrimethamine combination. And Fancida is one of the popular brands known. Most African countries, including Nigeria, have adopted the IPT nationally to reduce the burden of malaria in pregnancy. For travelers or visitors entering a malaria endemic region, malaria can be prevented by use of drugs which suppresses the blood stage of malaria infections, thereby preventing malaria disease. If you are traveling to a malaria endemic region, you will need to consult your national disease control centers for relevant information. Recently, countries such as China and Malaysia have been declared malaria-free. There's a need for the Nigerian people and its government to invest in efforts to defeat malaria. Funding should be prioritized for the most marginalized and hard-to-reach populations who are less able to access services and hardest hit when they become ill. Nigerians need to step up in collaborating with other countries in researching for an effective malaria vaccine. It's interesting to know that the UK, Kenya, and India were instrumental in the development of the Matrix M vaccine. Nigeria, with the largest burden of the disease, ends up, as usual, being a consumer of the vaccines. Lastly, we need to implement already laid down strategies and tools available to prevent, diagnose, and treat malaria, particularly amongst the underreached population. It is time to deliver zero malaria. Let us act now.